A good lumbar stabilization exercise progression that can be beneficial in a relatively wide range of ages and athletic ability is by incorporating dead bugs. Dead bugs can be progressed or regressed depending on the irritability, pain, or to meet the patient at their current functional level. The patient will lay supine on a mat or table and assume the position with all four extremities in the air. The arms will be at 90, hip flexion at 90, and knee flexion at 90 degrees as well. It is important to isolate the lumbar region by having the patient posteriorly tilt their pelvis by pushing their lower back into the table and using the drawing in technique. By doing this, it allows the patient to primarily engage the transverse abdominis and multifidus, which both create or contribute to providing stability. To start, the patient can assume the position with 10-second holds of pressing their lower back into the table. Progressing from this exercise, the patient can maintain that posterior tilt or pushing of the lumbar region into the table or mat while extending the right arm and left leg. This provides a higher degree of challenge while engaging the core musculature. It is important to maintain contact of the lumbar region to the mat to optimize effects. Another progression of dead bugs is to use unstable surfaces such as a foam roller. By adding this element of challenge, we are implementing the idea of automaticity, as it requires a large portion of core activation to maintain balance on the foam roller. And it is important to maintain the posterior tilt of the pelvis to perform this action. It is also important to remind the patient to breathe throughout. Although it may not be applicable to most patients, but incorporating unilateral approach will provide more of a challenge. We can do this with more of our athletic patients. So what we're going to do, we're going to bring them arms up. And from here, we're going to bring the knees up to right to here. Good, I want these knees right here. I want them to be horizontal with the table. Okay. And from here, we're going to work on our core. So we want to have that lower back. Yep, good. Tight right to the table. We're going to hold that for 10 seconds. And keep pushing that table. Good. And then relax. Right there, we're going to do that a couple times. We're going to go 10 seconds each time. Remember, I want you to engage that core and push that lower back right into that table.
Okay.
All right, in order to progress the dead bugs, we're going to assume that same position with the arms straight out and those knees right at 90. Okay, keep them horizontal. And from here, we're going to extend that left hand and also that right leg at the same time. So go ahead. Good. Remember, push that lower back and then bring it back up. And then we're going to alternate. So this hand and this leg.
Okay.
Good. Keep that lower back right there. And back up. Good. So we're going to do a couple sets of these. We're going to do 3 sets of 10. But when we get out to the end range, so when you're fully out, I want you to hold that position for 3 seconds before coming up.
Okay.
So let's try it. Engage. Start with that left. Good. Hold. 1, 2, 3. Up. And then switch. Good. Alright, to progress the dead bugs even further, we're going to act like this is a little foam roller. You would not do this on a table. You do this on the ground for safety. But essentially, you just have your patient, can you sit on that? Okay, and then lay right back down. So you're going to keep your feet up right here for stability. And we're going to do the same concept. We're going to have them arms straight up. Engage that lower back. Good. And when we extend that left arm, our right leg's going to extend. Got 1, 2, 3. Good. And switch. Okay, we're going to do 3 sets of 10 of this on each side as well. And although not applicable to all patients, we're going to have those arms straight up again. Push that lower back in. And final progression, we're going to do actually the same arm, same leg. So as this arm extends, this right leg is going to extend the same way. Good. Keep that back tightened up. Go up. And then that left arm and left leg.